Good afternoon and welcome back to KW Property Management and Consulting's Community Association Best Practices monthly webinar series. I'm your host, Tim O'Keefe, an Executive Director and Partner with KW Property Management and Consulting. Last month, I mentioned that we would have Congressman Ted Deutsch on today's program to discuss the upcoming election, but Congressman Deutsch was called away to Washington, D.C., so we shifted gears and instead we will address an equally relevant topic today with a great panel. On September 25th, Governor DeSantis signed an executive order allowing the state of Florida to move to phase 3 of reopening. Around the state, most markets have been more aggressive in their reopening plans. But because the Tri-County area has been a hotspot for COVID-19 cases, we've been more cautious to open public spaces. This cautious approach has also been the common practice for community associations. Our panel today will address how phase 3 differs from commercial businesses versus community associations. As of this morning, Florida reported more than 760,000 cases of the coronavirus, and sadly, over 16,000 deaths. The total number of cases continues to climb, and news reports indicate that the U.S. is in for a surge with winter and the flu season just around the corner. The economy has taken a major hit since March. Unemployment rates climbed from historic lows to early March to highs of nearly 15% in May. In September, unemployment dropped to 7.9%, but millions of Americans are still feeling the effect of the pandemic. Congress is still arm wrestling over the terms of the next coronavirus relief package. Just this morning, I saw the news report indicating that the goal is to have some kind of a deal in the next 48 hours. Let's hope that something gets done to help provide assistance to many struggling Americans. As we start today's webinar, we have a new feature to get all of you more engaged. We added a poll question to our webinar format. You should all be able to see a number of questions that you can address. Throughout today's webinar, we will share the poll results as you answer these questions. We have much to cover today, so let me introduce our panelists and jump right into our discussion. I'd like to welcome back Dr. Josh Lenchus, who's the Chief Medical Officer for Broward Health Systems. You have a big job, Dr. Lenchus. Thanks for being available today. We look forward to hearing from how the medical profession has coped with this virus.
Thank you, sir.
And by the way, just show us your tie. You always have the best ties. Let's see that tie. All right, you got a bunch of medical things on there. Good job, Dr. Lenchus. You never let me down. We also have Gary Mars. Gary's a shareholder with the Siegfried Rivera law firm. Gary specializes in community association law and construction litigation. Welcome back, Gary.
Thank you very much. No tie though today.
That's okay.
I didn't want to compete with the good doctor.
You can be more casual during the pandemic, Gary. It's okay.
Absolutely.
Also, as a special note, Gary is not rendering any legal opinions today, just talking best practices. Alex Martin has joined us today. Alex is a Regional Vice President with KW Property Management and Consulting. Alex oversees a large portfolio of luxury high-rises in the Miami-Dade market. Alex deals with dozens of associations that make decisions affecting their owners and residents. Welcome back, Alex.
Thank you, Tim. And no tie.
Well, it does just prove it. The medical profession is still way more professional than the rest of us. So
let's keep it that way.
Yeah.
Agree.
So also, as we go through today, we've got a number of questions that were sent in earlier during the week as people registered. So I'll try to get to all the questions that came in. We had about 150 people register for today's event. And we also have about a dozen questions that I received. So we'll get through those as well. So Dr. Lenchus, let me start with you. So it's been a full 6 months since you last joined the program in April, which is hard to believe. But can you tell us what the medical profession has learned about COVID-19 that we didn't know about 6 months ago?
Yeah, Tim, first of all, thanks for having me back on it again. This is always a highlight to speak to you and your audience here. Yeah, I think that looking back over the last 6 months, one of the things that we can say is that we're a little bit more attuned to jumping on treating people earlier on in their course of the disease. You know, 6 months ago when we first started, we thought that this looked like the run-of-the-mill viral infection that affected the respiratory or breathing system. And in fact, that we were caught sort of shorthanded because this virus didn't act like viruses that we have been treated in the past. New medications were repurposed. There are experimental medications that came out in an effort to try to help us overcome the disease process. Some were more successful than others. I think the data on them overarching is still pending by and large, because it's very difficult to run what we would consider a randomized controlled trial where we assign patients to two different groups in the middle of a pandemic. I mean, nobody wants to be assigned to the placebo group where you're not going to get anything if there's a potential to get something that may help you. So science has been a little caught off guard in terms of doing this. The testing that we had 6 months ago is in a lot better shape today than it was then. Personal protective equipment, we were concerned about having enough of that, primarily because our sourcing of that, our supply chain really originated in China. And of all countries to hit first, that was not a good country to hit in terms of sourcing materials. So we had to pivot, and we had to position and become rather nimble and creative, which is not usually what medicine does in general. We heard early on, situations where countries were overrun with people coming to the hospital and running out of resources in the hospital, ventilators and beds and et cetera. And we, thankfully, in the United States, we haven't really experienced it to the extent that some of our European partners have done. And I think that one of the things, looking back in retrospect, I think that tremendous camaraderie and fellowship around the globe, really, in medicine, transcending all political factions and geography, I think has really helped to save the lives of countless people during this unprecedented time.
How is Broward Health done as far as the number of beds that you had allocated to potential COVID patients and the capacity that you have there versus the actual reality of people coming in and needing ventilators in those special rooms?
Yeah, that's a great question. Again, early on, I think that the data were showing that in that sort of first wave in the sort of late March, early April timeframe, we were seeing a lot of patients that were coming in over the age of 65 that had a lot of other medical conditions, and they were not doing very well if they made it into the hospital, let alone if they made it into the ICU, into the intensive care unit. I think that as that wave receded, it gave us enough of a pause to regroup, so that when that second wave hit in sort of the mid-July-ish timeframe, that we were a lot more prepared. When you look at the numbers, that second wave actually in July was higher than the first wave was in March, April. So I think that it shows that despite the onslaught of patients that required medical attention, that we were better prepared. And the other thing that we saw in the second wave that was different from the first was the age of the patient was lower. So younger people were getting affected, but those patients were not quite as sick as the patients were in the first wave. And I think it helped us move patients through the hospital efficiently so that we were not overrun. We designated areas of the hospital as COVID-19 areas early on. And I'm proud to say that due to aggressive management of patients and moving them through the system efficiently and safely, that we did not become so overrun that we had to fall back into our crisis sort of contingency plans. We've done rather well. I think if you look at the Tri-County area, we've done pretty well. Certainly Miami was hard hit, and even the Memorial system in the South Miami, in the South Broward area was hit, because you had all of the folks from the northern Dade County were kind of spilling over the county line and coming to the Memorial system. Our geography was positioned such that we had maybe South Palm Beach and really the northern 2/3 of Broward, and we were able to manage that pretty accordingly. Again, in concert with the folks, Miami held on to their patients pretty well, except for that northern portion. Palm Beach County above us was able to do what they were able to do. So we fared, pretty well. We were not overrun. We never had a situation where despite contingency plans, we never had a situation where we had to execute those.
So we did see, I guess a little bit of a flattening of the curve in early summer, and then it's kind of spiked a bit. So what's been the biggest cause of the increase in cases over the past few months?
I think what we're seeing is we see there's so many factors at play. When you shut down the entire economy, when you shut down all businesses effectively, assuming that is a containment measure, as people get out, remember this thing is not operating in a vacuum. There are still people who are still essential personnel that are still going to work and could contract the infection. As you start to open the economy, I think it follows a natural progression that more people will get infected. I think what we're seeing, however, and I've continued to maintain this the entire time, despite what you mentioned initially of 760,000 cases in the state of Florida this morning, I think the real number of that is probably 5 to 10 times that in terms of people that are really infected. And I say that based on the fact that we know that still to this day, 4 out of 5 people that are infected are asymptomatic. They don't have any symptoms or signs of being sick, or they have sort of a cold-like or flu-like illness that they basically write off, and it does not require them to be hospitalized. I think that's a good thing. Not good that people that we have so many people that are infected, but I think it's good that still 6 months, 7 months later, in this country, we're still seeing the vast majority of people that are not overrunning the healthcare system, and that's really what it is, right? I mentioned on one of the prior panels, if all 22 million people in the state of Florida were infected, I mean, from my seat, that's not a bad thing because they're not all in the hospital. And having people infected, but able to manage that as an outpatient or be able to isolate at home and take fluid and rest and soup and that kind of stuff, that's way better than having even 1/4 of that number of people be needing emergent medical care, because that would overrun our healthcare system. And
So
that's
talk a
really
little bit
what the
about
concern
the
was.
treatment for the virus, which sounds a lot like a cold or a flu, which is rest and soup. And my mom always used to give us tea and
Sure.
cinnamon toast. That was always a cure for everything when I was a kid. But is there a formula of medication that's proving to be successful? We know President Trump went in and he came out with whatever miracle drugs were administered, but is there something that's working really well that is getting people healthier faster?
Yeah, that's a good question. President Trump received some of the experimental therapies that we could employ at our hospital here. The nature of the disease is a little bit different in terms of the medication. So earlier on in the disease, you want your immune system to be robust enough to fight off the infection. The problem with this illness is that as time goes by, the infection wreaks havoc on your immune system. And in fact, it winds up causing a cascade of events to the point where your immune system is fighting so many battles at the same time that your immune system starts to attack your own body. So there are points within the spectrum of the infection where you don't want to shut down your immune system. And then later on in the infection, you do want to shut down your immune system because that's really what's causing the problem. The medications that we used from early on, there was some talk about the hydroxychloroquine that the president's using. Depending on what paper you look at, there's either the data that says that it doesn't work or the data that says that we need more data. There's other medications that have been repurposed. I don't know that we have a miracle cure at this point. There's still things like the remdesivir that the president took. There's monoclonal antibodies that the president received that are experimental, plasma, steroids. There are these medications and interventions that are out there. I think it's relatively early to say with certainty that something absolutely works or that something absolutely does not work. I think in the interim, like I mentioned back in, I think the first webinar was probably early in March when you and I first met. And I think I would say the same thing that I said back then. Try to get exercise and eat healthy to the extent that you can. If you're missing vitamins, eat vitamins, stay hydrated. Those kinds of things I think will be. And if your mom makes cinnamon toast and gives you tea, then I think that those things are still still legit.
And what about blood type? I've read stories that, based on your blood type, the virus can be more severe based on, depending on what your blood type is. Is there any proof of that, or is that just conjecture at this point?
Yeah, there's a historical perspective on that where if you look back in the past, there were certain blood types that not predisposed, but people who had an infection, a viral infection before COVID, there was some association with a blood type. There's nothing you could do about your blood type. I think that the data right now is sorely lacking to prove causation at this point. Remember, anything that we do, it's retrospective. So if I looked at we look at the 47,000 hospitalizations in the state of Florida this morning, and we went back and we looked at blood types of all 47,000 of them, unless it would be a statistical impossibility for all 3 different blood types to be equally distributed. One blood type is going to be higher, and there's going to be a blood type that's lower. I don't think that it really. There's no data right now that has a definitive causation for that. So I wouldn't put too much stock in that yet.
All right, well, I'm more positive, so I was hoping that, if I get it, it's not going to be so bad for me because O is the best blood for it. So it's a selfish question.
Right.
As we turn the corner now and we start looking at phase 3 reopening in Broward County, have you had any, do people reach out to you and say, doctor, what should we be doing? Or is that all done at the state level and you're kind of just bypasses you?
Well, remember, phase 3 opened up for everybody else. The other 64 counties in the state of Florida before Dade, Broward, and Palm Beach opened up. And the reason for that was obviously because we were the 3 hardest hit counties in Florida. In fact, Miami-Dade County is still number 2 in the United States of all counties that are hardest hit, and Broward is number 7. So as we moved, we did meet with the governor. He was down here for a press conference, maybe 2 months ago or so. And we did have a conversation with the governor at that time, and he was very firm on looking at the number of cases in terms of percentage positivity before he would open up the Dade, Broward, and Palm Beach County. He did leave that really to the local government with their state guidance, and folks from Broward Health, along with other institutions down here, are involved in those kinds of decisions. I think to the extent that we weigh in from a medical perspective. Obviously, as you mentioned in your introductory remarks, there's other things that go into that, the economy and schools. How do you keep kids out of school and have them homeschool, yet you open up businesses where the parents are homeschooling their kids? So it becomes very difficult. There's sort of this domino effect or ripple effect as you open certain things, and they have to be done somewhat in unison. But yes, we as medical professionals and organizations have had conversations with our elected officials about when to open, how to open, what the right way is, and things of that nature. Yes.
So Gary, let me pull you into this conversation about reopening. I know we've got some slides that you put together, so we can pull those up. But talk a little bit about what it means to have phase 3 reopen now, and the impact on the community associations, decisions that need to be made inside the associations.
Well, listen, just so we understand, the governor has put forth a series of different orders, and so have our local county and municipal governments. They all have to be looked at. So as a starting point, the actions of the governor are important. Please don't misunderstand, but also have to look at those in conjunction with what your county and your local municipalities, if you're in one, are doing. So in that regard, just so we're clear, we have the governor reopening phase 3. That order went into effect on September 25th. We've already been about a month in on that reopening phase. So where we are now and how we've progressed, nothing has essentially changed since September 25th by way of gubernatorial changes. So what does that mean to us? And if anyone wants to read through the slide that we have up, restaurants and bars, nightclubs are opening at full capacity and they can operate in that regard. Commercial gyms, fitness centers can open. Businesses such as movie theaters, arcades, bowling alleys are able to open, pending obviously social distancing requirements. Sporting events can resume with limited capacity. Theme parks, vacation rentals can resume. Businesses can require customers to wear masks, but fines, penalties have been suspended again in the commercial market. So that's what the impacts have been with regard to this phase 3 reopening per this executive order 2024. And then if you want to go to the next slide, the Tri-County area has had a bit of a different, and this is the breakdown of some of those restrictions and how they apply to the Miami-Dade, Broward, and Palm Beach markets. So for example, just to point out something, in Miami-Dade County, interesting enough, the county ordinance now provides that according to the new norm, which was put out by Miami-Dade County, that persons outdoors are able to remove their masks if they can maintain a safe 10-foot distance from your neighboring person. That is uniquely a Miami-Dade County requirement. The other counties have other, requirements. Example, facial coverings are still required in Broward County, and only can remove them with regard to eating and drinking. All three still take into consideration social distancing requirements. Mask wearing is still mandated. We're still, trying to adhere to CDC guidelines. I know some of those, and I'm not going to get into the doctor's way on that, but some of those are interpretive and have changed periodically. But just to use the example about, the most recent case example regarding things are ever changing, just yesterday, a court order came out in the Miami-Dade market regarding the curfew, and it reimposed a curfew from 6 to 12, which is arguably against the governor's order, this phase 3 reopening order, which pretty much does away with curfew requirements. So the third district court has decided uniquely, I won't get into the whole discussion and intent behind it, but for right now, the county is still allowed to take into effect a 12 midnight to 6 a.m. Curfew, and that is a Dade County restriction. Point being is that each restriction is going to be mandated by your county, by your local jurisdiction, your municipality, if your association falls into a municipality. And those are the types of things you need to be looking towards, and all important.
So Gary, like the question that often comes up then as a result of this, so phase 3 says, okay, everything's supposed to be open, but what's this, and this is from more of a commercial standpoint, is to get the economy rolling again. What's it really mean for a community association? So you're in an HOA, you're in a high rise, and you don't feel like that's the most prudent thing to do as a board. Can the board be more limiting than what this phase 3 is allowing properties to begin doing? And what,
Okay.
how should the board think about that and respond if they come under fire?
Right. So that's a great question. And that is the seminal question, I guess, for me to answer on this webinar. And the answer to that is it can. In other words, a community association can be more, and I don't know if the term is more restrictive, but it can be more restrictive as long as it's not in conflict with any of these governmental ordinances and restrictions. It can be more restrictive. So for example, if a condo association, just picking on condos for a moment, makes a determination through their board of directors at a board of directors meeting that they want to have restrictions still on the use of their gymnasium because of whatever the rationale is, and they should obviously explain the rationale, but let's say we have limited ability to clean, we have limited resources, we have limited staff, the way it's physically designed may create a problem with being able to implement social distancing. Whatever the recognized rationale is, a board of directors can take those things into consideration and compose a reasonable rule and regulation that may be more restrictive than the county, which may be, or for this regard, as I just mentioned a little earlier, that all gyms are reopened again. Well, the fact that the government is saying, or the state in this case is saying that all gyms are able to be reopened, that's talking about commercial gyms, that we're not talking about community association gyms and other facilities. So as again, the recommendation would be your board of directors, if they haven't already, should impose reasonable rules and regulations, which almost every association that I've ever reviewed and represented has the right to do. Reasonable rules and regulations should be imposed at a board of directors meeting. There certainly should be the ability to explain that to your community, have unit owners be able to participate in the discussions as it should be done at an open board meeting. The fact that the governor has issued, which is still in effect, emergency orders and an emergency state of emergency for the state, which I believe expires in the beginning of November, is material, but it's also less material to this opinion that I'm, kind of discussing right now, or comment that I'm discussing right now, because I'm relying upon the right of an association to impose rules and regulations, which is a right that they have in accordance to their documents, as well as they can rely on the statute for that. So, the conversation which we've had in previous seminars and webinars before is relying on your business judgment. There's a corporate series of laws that support the business judgment rule, which is the rational thinking of a corporation and imposing rational, reasonable rules and regulations and going through the effects of doing so. On that, as well as your rights as a community association to impose reasonable rules, it is the right of an association to proceed accordingly. So things take into consideration things like, which I know if you want to pull up the last slide, I think we have on this, but these are the topic areas which have come up most predominantly. How do we deal with, again, because they were fairly restrictive with regard to usage of pools and fitness centers and community rooms. What is the view and how should we be progressing on that? Again, each association is unique, but just giving some general parameters on how to deal with it. Obviously, social distancing and guidelines need to be administered across the board. But these are a couple of the comments which have been fairly established, and I know that KW, for example, has also been recommending several of these with regard to their associations. But to kind of wrap them up, but if an association particularly has an issue with any one of these various areas, doesn't have the resources, doesn't have the manpower, it's again designed in a way that it can't be, we can't seek proper safety and security for our residents and occupants, then those are the types of things the boards need to take into consideration. One great example, again, as we're going into annual meeting season, are these community rooms, these meeting spaces. And a lot of associations have determined that they're not going to reopen them. And I think that, again, there's a rational, reasonable basis for doing so. And one of the great simple arguments is if we want to allow a certain size group to start reusing our community room, that may be wonderful. We may have to impose some financial obligations on that owner so that we can properly sanitize, clean, and ensure that it's being abused. But let's say we do have an event and there's 25 people or 50 people in a room, and there is something that happens in that gathering which is at issue. In other words, people aren't wearing masks and people aren't paying attention to the requirements, and there's, God forbid, an issue with some spread of infection as a result of that. Those people now are leaving, typically jumping in a valet parked vehicle. Your valet staff may now become infected as a result of that, and then that same valet staff is later servicing that same day a host of other occupants and residents and guests of that building. And you have an event, and again, I don't want to use terminology which is better for a doctor to rely upon, but you have spreader events that are occurring now, which now we've put the entire building in some sort of peril. So a lot of buildings thinking through that have said, the timing for us opening up and having gatherings, which are arguably may be difficult to control, it's not the right time. And if that is discussed and thought out at a board of directors meeting, I think it is within the reasonable rules of the association control and to create those types of restrictions.
So, Dr. Lenchus, when you hear this, talk about opening up, and we're just a microcosm of the economy. We're just talking about what we do in our world of property management. Do you feel like we're ready to reopen, or do you feel like this is still too soon and people are still going to get exposed? That it's just too uncomfortable for us to be doing this yet?
Yeah, I mean, that's $1 million question, right? We obviously can't shut down the country for a year And the fact is that even when we did, there were people that were still exposed. You go back to the height of when everything was locked down and we still had cases. It's not like we had 0 cases. I think the measured approach to opening is the right way to do it. Every time that there's an opening, we hold our breath in the healthcare system thinking that, what's going to happen. A couple of weeks ago, schools decided to well, they didn't decide. I mean, the governor sort of forced them, if you want money, you're going to reopen. So schools reopened, and so now we're waiting and we're watching to see what happens toward the end of this month and the next week or so to see if we have an increased number of cases. I think as people get out and start doing things, I think that time will tell. But like I said in the very beginning, we're not going to hit 0. The fact that we're under 5% consistently over the last 4 weeks in the state of Florida, I think is a positive notion, because we were a lot higher than that 2 months ago. So I think that the measured approach, like what was described by Mr. Mars about continuing to social distance, if you are going to open your community center, try to limit it to parties of 10 or less, or 15 or less, have people be masked, understand that people are going to take their mask off to eat, and hopefully nobody is part of that group that is sick. That's a great way to spread it. But I think that to continue to be locked down, I don't know that's going to do the intended. I don't know that that's going to have the intended consequence.
So do you feel like there's fear mongering going on out there? When this first came up and we first met back in March and had this conversation, this was this brand new virus. We really didn't know what the impact was going to be. We did know that it created fatalities. But as more young people get it, clearly, there's such a high number of folks that get it don't even know they have symptoms, and they just move on. So it still seems like there's a certain group of people, certain age group, and with pre-existing conditions that's most susceptible to the greatest harm from the virus. But most everyone else, if you're under a certain age, it's really just a day or two of inconvenience, but not something that you have to be overly concerned about and fearful of the fact that you're not going to survive this.
Yeah, I agree with you. I think when you look at the data, and I have multiple sources of data from the state and the feds, and when you look at the data from Florida, you're looking at the age groups that are highest predilection of the disease, of all cases, all 750,000 cases. You're looking at ages between 15 and 54, make up the vast majority of the cases. But when you look at the hospitalizations, interestingly, then it's a very shifted demographic. You get from 55 to 84 are the cases that are hospitalized. And when you look at deaths, there you're looking at really over the age of 75. So you see that the vast majority of people that are getting the infection are not the people that are getting hospitalized, and those are not the people that are dying. I have little kids that I was asked, are you sending your kids back to physically going to school? My kids are all under the age of 14. And when you look at the death rate, I pray that I would never have to face this, but of the 16,000 deaths in the state of Florida, there have been 5 under the age of 14. 5 out of 16,000. That doesn't even I feel horrible for those people, obviously, but that doesn't even statistically register. So the people that are really getting the infection and suffering harm from it are still really that demographic that we knew about 6 months ago. But what's shifted are the cases, right? In the beginning, we really saw the elderly people who were getting infected, who were progressing to hospitalization, and then some of those were dying. Now we're seeing kind of this a downward trajectory where younger people are getting infected, then middle-aged people are getting hospitalized, and elderly people are dying from the disease. So I think that if that holds, and now we've opened schools, and now we have these kids that are going to movie theaters and doing that kind of stuff, not the college kids like Mr. Mars was talking about, where they have these super spreader parties where you know that somebody's infected. Like back in the day, they used to have people who had chicken pox, and your parents would take you to the kid's house that chicken pox, so you got infected and you got over it. This is a little different. You know, not many people die of chicken pox, but people do die of COVID-19, and it's very different. So I think as long as we can rationally continue to open the economy in this phased approach, continue to do the measures that we talked about 6 months, 7 months ago about using the mask, washing your hands, staying away from other people that are sick, not showing up at work if you're sick. I think that we'll continue to see cases, but I'm hopeful that the case fatality rate, the number of people that are dying, will continue, that number, the percentage will continue to go down.
Dr. Lenchus, I have a question. Sorry, Tim. Of the group from the 75 and over that unfortunately passed away, do you know what percentage had underlying health issues?
The state, that's a great question. The state data don't portray that out. The fact that you're over 75 years old, statistically, there's a greater likelihood that you do have underlying conditions. We know that about 85 medically absent COVID, we know about 85% of patients that are over the age of 85 have high blood pressure. So high blood pressure is one of the comorbidities, is one of the other disease states that we have seen in patients that are hospitalized from it. So it wouldn't surprise me at all if the vast majority of those people had other medical conditions.
And so what we're doing as an organization, you know, we meet weekly with the district managers, general managers, property managers, the corporate team, come up with the best practices. We communicate weekly with our boards, right? And, you know, the recommendation, are we going to open the gyms? Are we not? But we are taking the safe way where, you know, because we don't want to become a super spreader, as you said, right? So what we're doing is, if we open up a gym, we're going to open at limited capacity. We're separating the machines by 6-10 feet. You can't use this machine, you know, no more than 10 people in a gym. If it's a gym that holds 30 people, we're closing the gyms down more often for 15-20 minutes to completely disinfect the gym, and then the new group can come in, you know, every couple hours. So we're trying to see, you know, pools is another amenity that we're opening as an organ. We're saying, you know, we can open it, but at limited capacity with our COVID protocols in place, right? So if you have a family, we will set up a family out in a corner. If you have a couple, we'll set them up a corner, but make sure we keep everybody. And then when they leave, we disinfect that area, and then we let the next resident come and enjoy that area. So we're taking this slow because of the unknown. But that's what we're doing as an organization out there.
Yeah, I think, look, I think you're doing it the right way. You know, the issue with the places that you talked about, gyms, clubhouses, community centers, rec centers, pool decks, you know, the only issue with those is that it's a fixed location that lends itself to large gatherings for long periods of time, right? I mean, if you opened a pool deck and you said, hey, everybody can go to the pool deck, you just got to be off the pool deck after 7 minutes, you know, that wouldn't be a problem, but nobody does that, you know? So I think having different groups in different areas at that limited capacity where you can keep families together, let's say, and people that are, if you're hanging out at the pool deck and you're not swimming in the pool, to the extent that you can keep your mask on, you know, you should keep it on. So I think that it still goes back, despite, like Mr. Marr said, I agree, the CDC has been all over the place on some of these things, but one of the things that they've maintained is they've maintained that close, prolonged contact. And that's really what we're trying to avoid. I'm an advocate for gyms. I think gyms are great. You know, you want to get in there and get healthy for sure. You've been locked up for a long time. I think it's a great idea to do that. Or going for a swim in the pool, I think it's a great idea to do that. But there's a rational way to do it. And what you've described sounds like a very measured and scientifically sound approach.
So Alex, one of the poll questions that came back is that 85% of associations have open pool decks. This is people responding to our polls today, with less than 20% of those not having limited capacity. So what, from a practical standpoint, what are we seeing in the buildings that we manage? Is this pretty consistent? Are most of the pools open now? Are people limiting capacity, or is it just everything's open, do whatever you want?
Most of the pools are open at limited capacity. In some buildings, we're taking reservations for a certain time frame, and then we disinfect the area, and then we let the other family or the resident, your neighbors come and enjoy it. At some locations, it's first come, first serve. We might have a space where we only can fit 30 residents at one time in the pool, where we are able to follow the social distancing guidelines. And it allows, and then in between, we give ourselves 15 minutes so we can disinfect the area, and then the next resident come and enjoy it. So gyms and pools are mostly open at limit capacity. We are making recommendations of like kids rooms, theaters, party rooms, meeting rooms, that maybe, because we're seeing that small spike now, if what I'm hearing, we might keep those closed for now to see what happens, and then we'll maybe pull the trigger as we get closer to the holidays. We'll see. We're watching the data out there, as Dr. Lenchus says. We're seeing what's going on, but that's pretty much overall what we're doing as an organization, and we're sharing a lot of best practices with each other and implementing those best practices on site. And we're communicating weekly with our boards. And what we do is, once we have this communication, boards in agreement. Some boards don't want to get involved, just do what we do. Some boards want to be very involved, so we involve them, and we come to a conclusion. We come to to an agreement, and then we communicate to the community, and then we implement the protocols.
So 70% of the communities in our poll have said that they've reopened the gym, with more than 85% of them imposing limitations on the quantity allowed at the gym, or using a reservation system to be able to use the gym. So I think that's great. And 68% are imposing limits of 25 people or less. So really 25 people is quite a bit. You have to have quite a large gym to be able to fit 25 people, I think, comfortably and safely in today's world.
Agree. And I had a question for Dr. Lenchus. What is your thought on UV lighting?
We know that UV light is a good antibacterial. It is good antiviral. It does kill a fair number of things. We have some hospitals have a robot, in fact, that goes in. It looks like a big stand-up air conditioner, effectively, and we extend it into the room. We block off the room, because obviously it's not good to have somebody in the room while this is going on because of its potency. And we can disinfect the room and turn that over pretty quickly. I think UV lighting is helpful if you can do it. I mean, Clorox wipes, certainly without a particular brand. I don't want to be biased, but having wipes or alcohol to be used. When people go to their gym, the commercial gyms, they're supposed to wipe down the machine after you use it. Many people don't do that, but you're supposed to do that for the next guy. I think doing that in between people would be helpful. Certainly washing the hands. I'm a proponent for a multi-staged approach rather than one thing. So I like what you said earlier about having that sort of staggered approach to when people come in, and then shutting it down, cleaning it, and then reopening. I think that's definitely a plus. The fact is that working out, I mean, as long as you can have infection on your hand, but many people wind up touching their face or wiping their brow or whatever. It's too close. Sweat gets in your eyes, you wipe your eyes. It's too close to your eyes, nose, and mouth, which can transmit the disease. So it's not ideal. I understand and recognize the difficulty in running on a treadmill with a mask. Some people are not able to do that. Eventually the mask is going to get sweaty, and it'll disintegrate on your face if it's a paper one. But I think the staggered approach, having things cleaned in between, limiting the capacity, I think what you're doing is spot on.
So Dr. Lenchus, we live in a state with a lot of snowbirds, and they're going to be returning soon, but we also have the just around the corner is flu season. So with flu season nearby, do you expect a surge of cases in Florida, or does our warm weather climate try to hold down the spread of the disease in the state of Florida?
Well, that's a great question. Not that long ago, one of the media outlets asked me the same question, and I'll give you the same answer that I gave them. And that is that I think I'm 50-50 on that. Part of me understands that there's a possibility of having a worse flu season this year because there's an increasing number of people that still don't believe in the vaccine. I mean, if that's you, I apologize. Not a lot of science based on that, but we in the medical profession do advocate for getting the vaccine as long as you can. But I think on the flip side of that coin is the fact that as long as people are staying away from each other with respect to their physical distancing, a lot of people are wearing a mask that they've never done before, and people are washing their hands and are more cognizant of that kind of hand hygiene, then there's a large percentage of me that believes that we'll have a lower incidence of flu illness this time around. I think the thing that'll complicate the situation, at least in my profession in medicine, is going to be the people that show up with these kinds of flu-like symptoms. We're going to have to assess them as to whether they have flu or they have COVID, because there's a lot of crossover. Now, some of the differences, however, the new loss of taste or smell is rather unique to COVID, and we don't find that in flu. The GI, the diarrhea, nausea, and vomiting is not typical to flu, where that would be more indicative of somebody that may have COVID. So we have our work cut out for us over the next few months. We would advocate continuing to do the hand hygiene, get the flu vaccine as long as you can. If you're concerned about having a reaction, there's a number of different flu vaccines that are out there. It's best to speak to your physician or your pharmacist before getting it. But the more people that get the flu vaccine, the better it is, and easier it will be for us to handle, whether they're coming from up north or they're here for the duration.
So when someone comes from up north, do you think that we should continue to impose some type of quarantine on the people that come in? Because that's going to be a big question. When go back 3 or 4 months, there was that 14-day mandatory quarantine based on the governor's executive order, but then that's since has gone away. So is that something that's going to be important, or do we feel like the symptoms come quicker if you have 3 or 4 or 5 days? That's going to be the extent of what you need. Can you talk a little bit about that?
Yeah, I think that I'm aware that there are some states that still have travel advisories that quarantine folks. I mean, a friend of mine just went to New York last week, and they told him that you're coming from Florida, so you got to be in quarantine for 14 days. And the guy said, I'm here for 3 days, and then I'm getting back on a plane, I'm flying back. How could I be here for 14 days in quarantine? And they wanted his credit card to bill him for $100 if the guy was out violating the quarantine. Of course, they didn't dispatch the state troopers to figure out whether the guy was sitting in an apartment for 3 days or whether he was out. I don't know that at this point, I don't know how useful that travel quarantine is, unless you're going to have some element of following people up and really making sure that they're in quarantine. The fact is that you could be exposed on the airplane. So now we have people that are coming and they're getting a test before they get on an airplane, and the test is only good at that point in time. It doesn't tell me that you can't get infected on the airplane. And if you're on the airplane, I mean, that's kind of the predicate of why you would impose a quarantine on somebody, because if you were infected on the airplane, you're going to probably, if you're going to show symptoms, you may show symptoms 5 days or so after you land. I don't know that I'm a big proponent of maintaining the travel quarantine at this point in time. I think if you're coming from another area, you have to look at the area that you're coming from. The Northeast that we imposed the quarantine on is not the hot spot now. It's really states like Wisconsin and Montana that are seeing a huge resurgence of cases. So if they're coming down here, I would caution them. They should be cautioned from the point of origin that, listen, when you get down there, it's probably not a good idea to go out and go to your local bar and restaurant and potentially infect other people. I think that we don't have the capability to impose the quarantine in a meaningful manner at this point I don't think we ever did, really, to be honest with you.
Based on our poll results, we have 97% of the people that have responded are either somewhat worried or extremely worried about the flu season this year. So clearly, for those that are on this webinar, that's going to be a concern for them. So having the proper protocol in the association, limiting large groups, making sure people wear masks. That's all important. And Gary, I want to turn to you with a question. Dr. Lenchus talked about, if I'm going to New York, they want my credit card to hit me with $100 if they see me moving around the building. What is the ability for associations to charge violations to owners that refuse to wear masks or don't comply with the rules that get set? And can you do this outside of condo docs, or do you have to do it inside your condo docs or HOA docs where you've actually got a violations committee or grievance committee that will hear out any kind of claim, whether somebody is, should be hit with a fine or not?
Well, there's no empowerment for an association to impose a fine other than going through that grievance committee process. So unfortunately, it really hasn't been something myself and my firm have been huge advocates of, because by the time you actually are able to enforce through a fine, the penalty or the violator is probably, well beyond his violation period in that regard. So it is, and then there's the added concern that in the governor's latest order, it does also indicate that, imposing a fine, which is arguably not an association issue, but it is not, from a public policy standpoint, it is certainly not being looked towards as an effective or an appropriate way to penalize somebody for violating, especially mask wearing. But let me just, Dr. Lenchus, you made some great points, and actually, Alex, leading on both of your comments, just a couple things. So, look. One of the things that I have been speaking of a lot is the fact that, associations have to address their population. And what I mean by that is that I've gotten any number of phone calls from, a 40-year-old board president saying, my concern isn't really myself, but we have several elderly individuals living in the building, and, we do need to impose things for the general population. I think that's a very shrewd way for a board of a community association to think about things, because obviously they're not just imposing restrictions to a particular age bracket, got to look at the entirety of their community. So if there's a higher susceptibility, particularly of major illness for somebody over 75 years old, and you have a component of your property where there's 75-year-olds or people that are or a little older, then certainly I think that you need to be considerate as to those rules you're going to be imposing. You can't do it in a vacuum. On another note to what was being said, I think we have to be very present, which is a difficult thing to do, but we have to be very mindful of what is going on in our community. So I'm giving you an example about a curfew that just went into, back into effect in Miami-Dade County. Other things may be happening. So we need to be mindful of numbers and outbreaks and situations and travel restrictions and things like that. I don't think an association independent of a governmental restriction is going to have a reasonable ability to impose a particular travel ban. I know that you're kind of implying that. I think that would be a difficult thing for an association to create a rule, because it is an ever-changing situation. That may be a little too difficult to impose, but I think we need to be mindful of what's going on. And I say that because, as Alex was saying before, as situations may change, as numbers may increase, as people may be getting sicker, let's hope it doesn't happen, we may need to reimpose some restrictions that we've kind of moderated over the past month or so since this phase 3 has gone into effect. So nothing is saying that can't happen, to your earlier question, Tim. So those are the types of things I think we need to be monitoring as we head into the winter and see how things are progressing.
So another poll result is showing of folks listening today that 83% of communities are not imposing self-isolation or quarantine on returning snowbirds. And in the poll, 29% of associations are imposing fines or other means of enforcing the wearing of masks as a policy in their community. So that gives you an idea.
But Tim, I don't want to misunderstand. I'm not commenting that we should, associations shouldn't enforce. I'm just suggesting that a fine may not be the right method. I think that letter writing, management letter writing, attorney letter writing, and if you ask the question, which I know is a question, what is probably one of the burning issues that are going on in my day-to-day activity and those attorneys that I work with, biggest issues is we do have that person that just refuses to wear their mask. not just in the gyms or in the pool deck, but going through the common elements, common areas of the property, potentially infecting other people. And then obviously then you have the reaction of those people who are concerned being reactive. And that's what's making newsreels now pretty much every night on the news, whether it's on an airplane or somewhere else. So the issue is that if you have a mandate to requires, and it is a CDC guideline, it may not be a governmental guideline. You do not now necessarily have to wash down after a use, but it makes complete sense, and the CDC is recommending it, and we're hearing the doctor continue that recommendation. We have to be very prudent in how we're doing things, and the board has adopted a procedure, and that's being violated by a unit owner. The board and management are going to have to deal with that individual. And that, again, may be letter writing, that may be, the lawyer getting involved. And for the most part, we've gotten people to comply with those types of tactics and those types of efforts. People eventually comply.
So I'd like to get to some of the questions. A lot of the questions are legal. Let me start with this question, Gary. I think legally, you can answer it better. What about associations imposing limitations on the number of guests and the duration of stay of guests in a property? And that's coming from Joe is asking that question.
So the question is, I'm sorry, can an association impose guest restrictions still?
Yes.
Is that pretty much what the question is? Yes. Look, it was more of a mandate, especially as we were heading into this COVID process. I think a lot of associations, I'm not saying that it can't still be considered by an association, it can be, but I think a lot of associations are now handling it differently now that we know a little bit more about the science. So it's not that they're restricting guests, they may be restricting the amount of people in an elevator, how people are traveling throughout the community association, how many people are using the pool, how many people are using social areas and things of that nature. So I think that's how associations predominantly have been handling that situation right now. But having an absolute restriction for any guest to enter the property, I think I'm just telling you what's in vogue right now has been viewed, and Alex, you could probably speak on that also. You're in the market on this all the time. I think is probably a little bit too restrictive because there are other means now that we do have products, sanitizing and hand gels and things of that nature that, we are able to move people through the property as long as it's done correctly. I think that has not been the norm.
And Alex, what are we seeing from a practical standpoint? Are we still seeing restrictions on guests in a lot of properties, or is it opening up?
It's in small percentages of the properties. We're still seeing some restrictions, but that's a very small percentage. Pretty much all properties are now allowing their guests.
So here's a question from Cheryl in Palm Beach. If the board invokes a rule stating any employee with a temperature over 99 degrees must take a COVID test, is that legal? And then does the manager have a right to ask for the test results? So let me start with you, doctor. Gary looks like he's thinking about that one. Is 99 degrees, at what point do you say, okay, you might be a high risk for COVID because of your temperature. Let's send you to get a test. At what point do you start doing that?
Well, the CDC looks at fever, temperature over 100. Of course, there's different places to take the temperature. So the best place to take the temperature is a rectal temperature. Most adults are not going to go for that, obviously. So oral temperature or under the arm temperature, they have the infrared temperatures. We're looking at over 100 degrees. Fever alone is one sign, but there's many things that can cause a fever. So that's what we do in terms of screening patients here. We look at 100 and above.
And then Gary, is it legal to make somebody go take a COVID test if their temperature is over some designated number?
No, look, I'm prefacing this by saying I'm not an employment lawyer. I mean, KW probably has dealt with this more directly than I have. I think if it's a reasonable restriction and somebody is showing signs of a temperature, to require them to get a test in order for them to come, and the only result that you can find out about is if they've tested negative, that they can indicate that. Anything else is not appropriate for you to find out, but or inquire about. But I believe that would be a reasonable restriction. But again, that would be something I think an employment lawyer at this stage probably has a lot more insight on.
And so if an employee tests at a certain level, maybe this may be another employee lawyer question, but do you think it would be legal for the manager, the management company to ask for the results of the test? Now, I don't know who's administering the test. Usually it's the either a front desk person administering the test. In some buildings you walk in, there's actually a temperature stand that you walk up to and get close enough to where it can read your temperature, and you can see what the temperature is. So there's different ways of doing it, but can you ask for that, or is that a HIPAA issue?
Look, records from the management company, as you're well aware, the records for the management company can, are not open to unit owner, review. So that would be a restricted document. So have the association, have management, if somebody is sent to go get a test because they are displaying some signs of possible illness, and to request that they provide some sort of acknowledgement that they're positive or negative, I think is reasonable. It wouldn't be part of the official records of the association for anybody else to be able to find out about, but it would be something that I think would be a reasonable requirement.
And Alex, how are we seeing that in actual real life work? Are most properties testing employees every day as they come in, or is that still hit and miss?
We are asking if they have any symptoms, cough, runny nose. In some properties, we are checking temperature. But I have a question for Dr. Lenchus here. I had a discussion with another doctor, and he told me that if I'm asymptomatic, right, and I'm walking around, my body's not recognizing a foreign object. So fever's not going to go up. So my temperature is perfect. Am I still spreading the disease? Am I still spreading the virus? I'm sorry.
Yeah, we know that there is asymptomatic spread. In fact, that's the vast majority, I think, of the patients that we're seeing now. So fever is a sign. There are other signs, certainly, but the lack of fever or the lack of symptoms does not mean that you're not contagious. Correct.
And I think earlier today you said about 80% of the individuals out there are asymptomatic, right? That's right. A lot more out there. So it's an argument, right? That we can, okay, I mean, we're trying to be proactive here and implement best practices, but that's a discussion I had with some. So we do check temperatures, individuals, we ask questions, and we try to be proactive, but it's not ever, I think, ever going to be 100% accurate, right?
I completely agree with you.
Another question, sorry, Tim, is the rapid testing. So I hear there's rapid testing coming out there. What are you hearing about rapid testing? Because I think this is a game changer, right? So we had the discussion about the Snowbirds coming down, right? And I love, because my goal is to protect the staff and the residents in the building. That's key. That's number one. Forget about everything else. If somebody's traveling from New York, somebody's traveling from Wisconsin, somebody's coming from one of these areas, if we could have them rapid test when they arrive, which is, I hear it's 15, 20 minutes. If this is true, if it's really happening out there, that's a game changer, right?
Yes, with a caveat.
Okay.
There's different testing platforms that are out already. Some are antibody tests, some are antigen tests, and some are what's called PCR tests. So the antigen test is basically like a pregnancy test. I mean, either you have the infection or you don't. Let me preface my remarks by saying that no test in the United States has been tested on asymptomatic individuals. That's a problem because 4 out of 5 people are asymptomatic. So the tests that are out on the market right now, which are all under emergency use authorization, remember, none of these are FDA approved, they're all under emergency use, that all of these were done on symptomatic individuals. So when you look at symptomatic patients, the antigen test is kind of a pregnancy test. You were exposed or you weren't, and it's better in positive and not so much in negative. The PCR test is a confirmatory test. Those tests usually take a longer period of time. The antigen test is a quicker test. And then there are the antibody tests that tell you, well, you may have been exposed at some point in time and are now your body has developed some element of antibodies. We don't know the level of antibodies that are required to protect the individual. I think that, there's saliva tests. There's a whole slew of things that are out there. I think it's how you fold them in and what they mean in terms of looking at a population.
Got it. Thank you.
Doctor, I had a question. You talked about the flu vaccine. Lynn in North Miami says that there's some folks in her community that have an autoimmune disease and who are compromised immune systems and have never taken a flu shot. Would you advise them to take a flu shot this year?
I would say the short answer is yes. There are different kinds of flu vaccines. People that are immunocompromised certainly can get the vaccine. They can't get the live vaccine. They have to get a recombinant vaccine, which is a dead or inactivated vaccine. It's best to check with their physician. Like Mr. Mars is not giving you legal advice here. I can't give you medical advice either. Otherwise, Mr. Mars will wind up defending me. So
I was just gonna caveat your comment with a disclaimer after you finished, but you did a good job yourself.
I appreciate that.
Sure.
So yes, it's not medical advice. I mean, the medical establishment recommends getting the vaccine, but as an individual patient, it's best to check with their individual physician.
And Mel's asking, when will a COVID vaccine be safe, effective, and available?
Yeah, I want to know too.
Yeah, that one would be, I think, insider trading if I told you that. But I will
Call
tell
me
you that
after we get off this call and let me know.
Yeah, I will tell you that there are two companies that are probably closest to the puck in terms of releasing that vaccine. One company is supposed to release their results from their trial here in the next week or so. We'll see what that does, and then they're going to pursue EUA approval. That takes several weeks from the FDA, and then they may have something probably closer to December. The other company is probably a month behind. They'll release their results scheduled to release their results probably right before Thanksgiving, and then they'll go through December for the EUA with the FDA, and then they may release that in January. I think the medical establishment is still really waiting to see what the results of those studies are to determine whether it is safe and effective, like your participant has indicated.
Have you seen cases? Can people get the coronavirus twice?
You know, I just read last week that there was one case that was documented in somebody that had gotten it before and had been reinfected. I don't know about that yet. I mean, it is a virus, like if we think of it like the flu, I mean, you certainly can get the flu more than one time. You can get chickenpox more than once. You can get other viral infections more than once. I wouldn't be surprised if you could get this more than once. I think the question would be what strain you're getting and whether that is worse the second time around, like something like Ebola or dengue, which are viruses, or whether it's a little bit more less infectious the second time around. We'll wait and see what happens.
So Gary, we have a couple questions that are somewhat similar. Lynn in Miami Beach is asking a question about elections and how should boards handle 2021 board member elections, and can these be moved because of COVID?
When we were working under emergency powers, I know a lot of those associations that had meetings scheduled for the March-April period, because it was such a new scenario, they did make elections. They did make the election to move their elections to a later period of time, and in so doing, they made those decisions under their emergency powers. We're still arguably, we have emergency powers still in existence, but what most associations have done, and you guys have been, exceptional as a management company, finding platforms to these that are in compliance or as close to compliance with the Florida statute, is we're doing these hybrid meetings or annual meeting where we are having a very limited amount of people at the meetings for purposes of, I'm talking about elections, for purposes of calculation. Again, most annual meetings are only cycled to the election, which is what I would highly recommend under these environments. This is not probably the time to start considering, large amendments and other things to be done at the same time, just because it'll involve more people and we're trying to limit the amount of people. So having participation predominantly through a Zoom platform by way of unit owner participation and having a controlled amount of people in a physical room has been very much the norm for this upcoming annual meeting period that we're coming into. So we've been working with management to do that. Some associations are proceeding with the right of the association to do the outside ballot pre-registration at an earlier period of time on the day of the annual meeting, which the statute allows you to do, so that at the physical meeting, it's typically just the opening of those ballots and the calculation if you're in a condo environment, and similarly for homeowners associations. So at this stage, it would probably be the view of the state that there are other methods in order to proceed with your annual meeting to keep it safe and secure, and that you should consider adopting those procedures.
And one of the things that I've seen that KW has done is limit the number of people in the room to 10 or fewer, get a volunteer or two from the community to help count votes, have the association attorney present to validate that it was all done legitimately, and do it on a Zoom call or so that it's under camera, and there's going to be no question about the legitimacy of the election. But then as a follow-up, Kathy in Vero Beach is saying, are we obligated to do any virtual board meetings so owners can call in once during this whole COVID process?
Well, that's a different issue because that's a board meeting. So unlike an annual meeting, which is, again, if the meeting is predominantly the election process, there's not really a grand opportunity for unit owner participation other than the attending of their ballots in. But for board meetings, you should be adopting a platform where there's some ability for the unit owners to be able to communicate or their questions or comments on each agenda item. So there's been a variety of different platforms that I've seen, several of which I participated in. Some are verbal, some are closed mics with the ability to, have a hand raise icon or something so that you're called upon. Some have gone with a webinar format based on the size and participation, where people are able to type in their questions and there's a pause given at the if a motion is made or if there's a segment of the agenda. I know you guys have played with a lot of those platforms also, and many of them work. I think that you kind of have to figure out what's best under the environment, situation, nature of your meeting, and the state of your own association.
Okay, so we've gone a little bit over time as usual. So if I could get just one more comment from each of you, and Dr. Lenchus, I'll start with you. So we've gotten through the first 6 months of COVID. What do we expect for the next 6 months? Because, all we've done is learn so far. We don't have a cure. There's no vaccine. People are more comfortable. People that lock themselves down in the first 90 days. I know many people in my neighborhood that I didn't see them, and now they're taking trips, they're getting on airplanes, they're going to the Keys. They're out and about, so they're less concerned than they were before. So what can we expect over the next 6 months?
Well, I think we're gonna see continued learning about the disease. I think the cases will continue to. We'll still have cases through this time frame. I think hopefully after the election, after the presidential election, there will be less angst about a vaccine. I don't think any party, despite your political sway, I don't think anybody wants to put something out there, and certainly not in the medical profession, put something out there that's not safe and effective, as was mentioned earlier. And I think we would be hopeful that the vaccine would be something that was curative and protective. In the meantime, I think we have to follow the same things that we've been doing for the last 6 months, and that is with the mask. And I know there's a COVID fatigue, but we got to stay the course. This is the reason why 100 million people around the world are not infected, because we've been successful at mitigating this to a large degree. So washing your hands is never bad absent a pandemic, and using a mask and staying away from people that are sick are still tried and true measures to keep yourself safe. Take the precautions that you need to take in order to slowly get back into the swing of things. Airlines are doing an incredible job at trying to keep those folks safe that fly on the airplane, and you could do the same thing. It's not going to kill you if you go 2 hours without a drink of water or 3 peanuts. So you can keep your mask on. It'll be okay.
All right, thank you, Doctor. And Gary, for you, what's the best advice you can give to associations relative to reopening while also trying to be protective of the association without fear of repercussion from other owners about lawsuits because they're being too cautious?
Listen, I'm going to answer that in 2 quick ways. To the association, my comment is, and I think it's leading right off the doctor's wisdom, is you got to find your balance. You got to know what's going on. You got to see what the government is saying. You have to see what the CDC is saying. You have to monitor. We have to remember that these are community associations. What I decide to do in my single family home may be different than certainly you can do when you're the organization administering the decisions for a property where multiple individuals are living together. It's a different scenario. So you've got to find that balance, and it's incumbent upon these boards and with the assistance of management and law. And obviously, if we have a great consultant to go to, like Dr. Lenchus says, is available, but we got to keep a balance going as to what we should be imposing based upon the needs of our particular community, the makeup of our community, the needs of our particular community. And again, having a valet is different than not having a valet. Having a huge elevator is different than a small elevator. Each one of these properties have to kind of evaluate themselves and stay the course. I think what I've learned from the doctor's comments is stay the course. There really hasn't been a drastic change. And I'm adding as a fact that the fact that the governor of, has opened up a phase 3 or whatever doesn't really make any real huge change to how you should be operating your association. That phase 3 opening did not mandate changes to how your property should be operating. It's essentially the same. We've had some more localized ordinances which have been opened up as a result. But you just need to be aware. You need to be aware of what's going on. And on the property, second comment would be is for all the owners to understand also as the occupants of these buildings, because that is really the thing that's coming to us currently the most. It's not the general enforcement of rules and regulations that make sense. It's the odd person who has an issue one way or the other with those restrictions. Please remember what I just said. Again, these are community associations. When you buy in a community association, you buy understanding that you're going to be living with other individuals. You cannot mandate your own particular interests independent of the common good or the decision-making for the property, unless they're unreasonable. So as long as these rules and regulations are reasonable and you are obligated to wear a mask, or you can't go on the elevator when 3 other people are on there and you have to, again, I understand it's a bit of an inconvenience, but it is the restriction that's being imposed. You need to respect it. And you don't need to cause that acrimony, which I know we're dealing with in the management and the legal world quite a bit. It's just not worth it. It's all being done for the safety and security of your community, which is, like Alex said, that's our paramount concern. And that's what we got to be focused on.
Well, Gary, if there's one good thing that has come out of the pandemic that we're in right now, is it's reduced the number of questions we get about pets. So
service animals.
Right. And then Alex, for you, what's the best thing you can do to recommend best recommendations for boards to keep their property safe?
It's easy. As a community living is community living, right? So just be kind to your neighbors, respectful. If you're going to walk out and not want to wear a mask and be confrontational, just wear that mask till you get to the car and then take it off. Don't try to prove a point here. That neighbor that's in the elevator with you might have a family member that has an underlying issue and they're taking extra precautions and they're very nervous because they don't want to get it, so they don't give it to their family member. And it's easy. And that's what community living is. It's the one thing I can leave you is just be kind and to each other and when you see your neighbors and respectful. It's easy. It's your neighbor, and you could save a life. You could save a life if you just do that.
Great. Thanks. The golden rule always works, right? So today's conversation was great. Our panelists did a fantastic job. And we also had some great questions that came in from our webinar attendees. Our sincere thanks to all the folks that registered and dialed in today. We appreciate you being on. Today's session is recorded. You can watch this broadcast again or share it with a fellow board member. You can find it at our website at kwpmc.com, and you can go to our YouTube channel, our KWPM YouTube channel that we now have, and we post a lot of great webinars and advice that board members can use. I want to sincerely thank our panelists, Dr. Josh Lenchus, the Chief Medical Officer for Broward Health, Gary Mars, a shareholder with Siegfried Rivera, and our very own Alex Martin with KW Property Management. We look forward to having you join us again next month on Wednesday, November 18th, when we will continue our webinar series of best practices in community associations. From all of us at KW Property Management Consulting, thank you for making a difference in your communities, and remember to wear your masks, respect social distancing, wash your hands, and stay healthy. Gentlemen, thank you so much. You did a great job. Look forward to the next time.
Bye, everyone.
Thank you.
Bye now.
Take care.